Back here's a story a lot of people talking about. Georgia's Department of Public Health recently confirmed a case of measles in an unvaccinated person in Fulton County. Joining us now to talk more about this and how you can stay protected is Emory professor Dr. Jodie Guest. Thanks for your time.
Absolutely. Good morning.
Let's start with how contagious is measles.
It's one of the most contagious things that we can have. 9 out of 10 people who are exposed to it, if they're unvaccinated, will end up with the measles.
So that would explain why the Department of Health was very quick to point out where this person had been when they were in that infectious period. We're talking about potentially spreading the virus for over a week at some busy places, college campuses, restaurants, even youth sports games. How do you even begin that process of tracking down everyone who may have been exposed during that window?
Yeah, this is a tremendously high number of people that have potential exposure. We're most concerned about those who are unvaccinated, but you start by knowing exactly where the person with measles was and what the hours were. Because some of the exposure was at a college campus, you can actually look at IDs and swipe cards about when people get in and out of buildings, but you need to put out big alerts and you need to make sure you are doing contact tracing. This is a massive undertaking for the Department of Public Health.
What does it tell us about our community's vaccination coverage when we see a measles case in an unvaccinated person? Talk about what level of concern you see and maybe the attention people should be giving this.
Well, what we know is that of all the cases of measles we've seen this year, 92% of them are in unvaccinated people. The vaccine works extremely well to protect people, and so we're most concerned about those who are too young to be vaccinated yet, or those who are not vaccinated. So first thing we want to do is make sure we talk about how great the vaccine is, but then we want to talk about anyone who could be exposed if they are unvaccinated. And as we see vaccination rates dropping in our state, we are going to continue to see cases bubbling up.
What vaccination rate do we need to maintain to have sort of that most comfortable situation?
Yeah, so what we really want to see is 95% of our kids vaccinated, and they get vaccinated twice when they are young, 12 to 15 months, and then a second vaccine second dose when they're 4 to 6 years. And 95% is where we want to be. In the state of Georgia, we are at 87%.
All right, let's just reiterate that. We are currently at 87%, and you say 95% would be ideal to keep everyone protected. What steps may hospitals and clinics maybe be taking to prepare for potential measles patients so that they're not creating exposure risks for others who are coming in and out of those buildings and offices?
That's such a great question. So alerts have gone out to all clinicians in the county and the state about a high risk of exposure for measles. And so clinicians are looking for people who are calling in with very, very high fever, rash, runny eyes, runny nose. So some pretty basic symptoms, but the rash is very indicative and the fever is extremely high. Really what we want patients who have these symptoms to do is actually call their clinician first rather than coming. But if a clinician sees a patient in this category, they're going to isolate them immediately.
Okay, and we saw some video of that rash a little bit ago, so that's a telltale sign. Keep an eye for that high fever as well. For parents or adults who perhaps might be unsure about a vaccination status, what's your most important message right now?
Well, so if you have a child who's not been vaccinated, now is the right time to make sure that they get vaccinated and to start that series. If you are an adult and you don't know about your vaccination history, it does not hurt to be vaccinated again, but you do want to talk to your clinician about it to make sure.
All right, that's a good point because I don't know that I remember everything from that many years ago. So really important points. Thanks so much for the insight, Dr. Jodie Guest. Appreciate the time.